Hi, everyone. Let's get started. Welcome to the fourth and final session of Pandemic Storms, Pause, Reflect, Act, the UVic Faculty of Education's COVID-19 Research Symposium, taking place every Wednesday in May from noon to 1 p.m. We're really happy that you could join us today. For those of you that don't know me, I'm Tanya Battersby, Research and Grants Facilitator for the Faculty of Education. I'll be facilitating today's session. And I'd like to begin by respectfully acknowledging that UVic is located on the traditional territory of the Lekwungen peoples and the Songhees, Esquimalt, and Saanich peoples, whose historical relationships with the land continue to this day. Before we begin, I'd like to remind everyone to keep yourself muted unless you're speaking. And if possible, we'd like you to keep your video on so that the presenters can see your faces, because that's nice for them when they're speaking. If you run into any trouble using Zoom during the session and you need technical support, please feel free to post an SOS in the chat. Courtney and Hector are here and they'll be monitoring the chat. They're on standby to help you troubleshoot any issues that come up. And finally, we're recording the presentations and this event is being live streamed on our YouTube channel. So after the session, the link for this video will be posted on the event homepage. And without further ado, I'd like to introduce today's session and presenters. So our first presentation from Dr. Sarah Nutter is titled, How Does Communication of COVID-19 Risk Factors Influence Weight Stigma? Dr. Sarah Nutter is an assistant professor in the Counselling Psychology program here at the University of Victoria. She conducts research broadly related to weight-related issues, including weight stigma, body image, and eating disorders. Her primary research focus is on weight stigma, and she's especially interested in better understanding sociocultural and ideological influences on weight stigma, as well as the influence of weight stigma on healthcare. Welcome, Sarah.
Thank you. Thank you so much. Okay, I'll get the screen share started here. And there we are. Okay, so before I get into my presentation, I just want to start by acknowledging that I am finding myself on Treaty 7 land in southern Alberta today. So I'm joining you virtually from the land of the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda Nation. And to contextualize my research, I just want to talk about, the story of risk factors in the pandemic. And at the beginning of the pandemic, age emerged as a risk factor pretty early on. But overall, I would say, my perception of how it was written about in the news and communicated to us was quite positive. There was a tone of needing to protect our seniors. There's rightly so been outrage at horrible conditions in long-term care homes where COVID has run rampant. And that conversation has felt the way it should to me, wanting to protect people's lives and protect our seniors. And when weight emerged as a risk factor, I felt that there was quite a different tone to the story, but I know I'm sensitive to the tones of stories in and around body weight. But we can see here the story in the New York Times, the pandemic is a wake-up call for personal health. And so the tone that weight as a risk factor took on felt a lot to me like a tone of individual responsibility and blame. And this, underlying message, well, if only these people would have taken care of their health, they wouldn't be in this mess. And so that really sets the context of, the discourse in and around weight as a risk factor for developing serious COVID-19 symptoms. And for me, what it really boiled down to is weight comes with pre-existing stigma in our society, and with this belief that weight is as simple as calories in versus calories out, and it's a personal and controllable responsibility. And, we know that this research is not, or this discourse, is not supported by research, and weight is actually incredibly complex, but that's not, this wasn't a research-informed discussion. So before I move even more into the project, I just want to note the people behind the project. So I had a number of people from the Everybody Matters Collaborative at Obesity Canada support me in this. Although I've taken the lead on this project, they were there to consult on the idea and the development of the survey. And so I'm thankful for all of their expertise. And I also had Jessica Clark from our counseling psychology program here as my research assistant to support this project. So thank you to all of her hard work in helping this project become a reality. So what is weight stigma? Well, we can see here weight stigma is prevalent in all aspects of our society, and a big part of where it comes from is our entertainment media and our other media that is communicating to us every day what we should think about when it comes to weight. So we can see here, you know, the way in which Howard's mother was portrayed on the TV show The Big Bang Theory. She was a character we never saw on the show. We never saw her one time, but we knew what her weight was because of how all of the characters talked about her when she was, you know, in another room yelling at Howard, or Howard was just talking about his mother in general. We see weight stigma in the way in which we're obsessed with celebrity body weight, especially during pregnancy and postnatal periods, and you know what celebrities look like in bathing suits. The idea that weight is simple and is an individual responsibility is reinforced in reality TV shows like The Biggest Loser. And we see weight stigma in our public health campaigns. You know, the idea that all you need to do is choose less to weigh less reinforces this idea that's simple. Then PETA here in the bottom corner has just a really heartwarming advertisement trying to get people to eat vegetarian so they don't, you know, get fat and become a whale. So I think that one had some outrage. So this is the context of this pre-existing weight stigma in society that set the stage for the discourse on weight as a risk factor during the pandemic. We see weight stigma in all levels of education. We even see it in the graduate school admissions process. So this isn't something that is restricted to K-12 education. It happens in all aspects of healthcare. Weight stigma has been documented among all kinds of health professionals and influences the quality and quantity of healthcare that people with higher body weights receive. We see weight stigma in employment, so as a barrier to employment or promotion, as well as having a negative impact on wages across the career span for people with higher body weights, especially women. And we also see weight stigma in family and peer relationships. So weight stigma in terms of weight-based conversations among parents and their children, who peer friendships, who children want to play with, and social exclusion, as well as in our intimate romantic relationships. And the consequences of this in healthcare is significant. So as I said, you know, there's less time with patients with higher body weights, often in their healthcare encounters. They might also experience poor patient-centered communication, negative language like having a negative tone of voice, saying things that are explicitly insulting about weight, or using words that patients feel are insensitive. Researchers have found that healthcare professionals often give fewer treatment options to their patients with higher body weights. We'll focus the conversation more around weight, say, even if it's unrelated to the presenting concern, weight will come up in the healthcare encounter. And all of this leads to a higher rate of avoidance and delay among patients with higher body weights. So they might, you know, have a encounter with a healthcare professional and then really not want to go back. And sometimes that can mean that there's a healthcare seeking delay to the point where a condition is exacerbated or worsened because people aren't seeking healthcare when they need to. So along came COVID-19 in this weight-biased context that we live in our culture. And so I was really interested in better understanding the influence of the way in which news media was educating the public about weight as a risk factor, and the way in which that conversation was being taken up over the last year of the pandemic. So in my research study, I recruited just over 400 participants using Prolific Academic, which is an online data collection platform. And I collected data from participants in Canada, the UK, and the US, and we had an equal number of participants from each country. About half of our participants were female, and they ranged in age between 18 and 77. So we had a nice large age span there. And over half of our participants were white, 18% self-identified as Asian. And the remaining 5% identified as each Black, Indigenous, Hispanic, and biracial. And so what I had participants do first was complete measures of social ideology, the first being right-wing authoritarianism, which is generally defined as support for traditional values and deference to authority. Social dominance orientation is defined as support for group-based hierarchies. And belief in a just world is just that, the motivation to believe that the world is a just place where people get what they deserve. I also had participants complete measures of contact quantity and quality, because oftentimes we know that the more contact you have with the stigmatized group, the lower your stigma and prejudiced attitudes are likely to be. So that's an important measure to examine. Then what I had participants do was read 3 real newspaper articles. I took snippets of the article. They didn't need to read the whole thing. Participants were divided into 3 conditions. So one condition read weight risk factor articles, the 3 articles you see here on the slide. And the other 2 conditions read age risk factor articles, or articles related just generally to the second wave of COVID-19. And these articles were selected as an accurate representation of the landscape. And there was also one article from each country surveyed so that participants would be familiar with the news source. My favorite being the Psychology Today article. If you don't want to get COVID, obviously you lose weight. That's the one thing you do. So participants read these articles, or at least, glanced at them for a couple of moments. And then I had them complete a number of measures, including affect, so emotional reactions towards people with higher body weights, a measure of blame or moral judgment, a measure of internalized weight stigma. So how much are these participants turning in the weight bias and stigma towards themselves? How much are they directing it towards other people? So a measure of explicit weight stigma. And then I had a number of items about perceptions of weight-based risk. And so that's where this figure is important to consider. So I showed participants this image of 5 silhouettes of people of different body weights. And I asked them if, who would be more likely to contract COVID-19? If all of these people contracted COVID-19, who would be more likely to experience severe symptoms, and who would be more likely to die due to severe symptoms of COVID-19? So what did the data say? I'll preface my results section by saying the results are preliminary. We're still looking in and around the data, but I have some exciting stories to tell so far. So we found that social dominance became a really important variable in our study. So just to remind you all, social dominance is defined as that support for group-based hierarchies. So there's different groups, and groups are on a hierarchy of good to bad or best to worst. And among participants who read weight as a risk factor article, those who were high in social dominance tended to have higher levels of explicit weight stigma post-manipulation compared to those who were low in social dominance. So this is, demonstrating that people who are predisposed to be more prejudiced because of their worldview, their ideology, reading these news articles are likely going to be walking around afterwards with higher weight levels of weight stigma. And this impacted internalized weight stigma in the opposite way. So folks who read weight as a risk factor news articles who were high in social dominance had the lowest levels of internalized weight stigma, and those who were low in social dominance had the highest levels of internalized weight stigma. So in this way, I felt that folks who were high in social dominance, when they read these weight as a risk factor articles, there may have been an unconscious process happening whereby, okay, well, those are those people. I'm not one of those people. And so I'm not directing those negative attitudes towards myself because I'm motivated to, think about those people who are, having higher weights and contracting COVID. Well, that's a different group than the group that I belong to. So perhaps, a protective process is happening there. And what I found, I guess, particularly interesting was just simply looking at the response rates when it came to those weight-based risk factor questions that I asked. So again, here's the image. And the first question I asked is, which of these individuals do you think is more likely to contract COVID-19? And I did give participants the option to say, I'm not sure. So we see that the most responses were, I'm not sure. But after that, there's a pretty large discrepancy between, who participants felt were going to be most likely to contract COVID-19. Overwhelmingly, the largest silhouette figure was selected. And so I thought, well, how does this match up to reality? Let's go to the research data on what we know about who is contracting COVID-19. And reality tells us that there haven't been, in the research anyway, a well-documented consistent pattern of higher weight people being more likely to contract COVID-19. What we have found is that men have been more likely to contract COVID-19, as well as people from different racialized groups and older folks. But there's no data to suggest that COVID is selecting based on body weight. So I found that interesting. And there were no differences between different conditions in relation to how people answered these questions. So I felt that, this overwhelmingly weight-focused discourse was likely influencing people's response rates here. The next question that I asked is, if each of these individuals were to contract COVID-19, which individual would you think would be more likely to develop serious symptoms? And look at that distribution. That is overwhelmingly favoring the highest weight person along the continuum. And how does that match up to reality? Well, let's take a peek here. So there's been research conducted using hazard ratios to identify who's at increased risk compared to other groups. And we do see, based on weight at all ages, that underweight people have a significantly increased risk of developing serious COVID-19 symptoms. And there is some increased risk when it comes to body weight with regards to hospitalization. But again, lower weight has not been covered in the news, just higher weight. And then when we look at ICU admission specifically, not just hospital admission, it's not as dramatic as the news might have us believe. The people who are being admitted to the ICU pretty much all have a similar level of risk, and things really start to creep up when we're looking at people with a BMI greater than 45. But that's not the story that we've been led to believe in the news, right? And then the last question I asked is, if each of these individuals were to contract COVID-19, which individual would you think would be more likely to die due to medical complications? And again, the responses are overwhelmingly focused on the highest weight person. And so I went back to some hazard risk research and some look at all-cause mortality based on body weight. And the results, again, are providing a more complicated picture than the one that participants were telling me in their responses. And that shows that the people who are experiencing the highest risk of mortality, if we look here, are people of older age. So we see 50 to 59, 60 to 69, 70 to 79, 80 and above. Like, this is significantly increased risk to COVID-19. And here's body weight right here. So we see people who are classified as class 1 obesity. I don't like BMI categories, but that's what was used in this research. Barely an increased risk. And sure, it jumps up when we're getting into higher body weights. But look at this risk compared to age and compared to men. where is the outrage that men are dying at a significantly increased rate? And what about diabetes? The story that is being told here with regard to diabetes is that folks with diabetes experience an increased risk, and not everybody with diabetes has a higher body weight. And so I felt that the discrepancy between reality and what participants were telling me in this data was a really interesting way to, I think, summarize the message that's being told in the media and what's not being told, and how simple the message is when it's really not that simple when we're looking at the data. So the preliminary takeaways for me so far are that for individuals who are predisposed to stigmatizing attitudes based on their, an ideological position that favors group-based hierarchies, reading articles about weight-related COVID-19 risk factors contributed to an increase in weight stigma, but a decreased internalized weight stigma. And that, really for me, the risk factor-based discourse really led to a skew in those perceptions of weight-based risks compared to data-supported trends. And that's all for now. Thank you so much for listening.
Thank you, Sarah. That was some really eye-opening data that you shared there. I want to give the participants an opportunity to comment or offer a reflection or ask questions. We have a few minutes here. If you would like to say something, you can just type in the chat the word question or comment, or you can feel free to type your question, comment, or reflection into the chat if you'd like to share anything with Sarah or with the group. So there's a question that's come in from Vivian. The question is, do you think the COVID messaging about weight will linger and affect weight stigma?
I think that's a really good question. I think it's going to be hard to forget all that we've heard about weight during the pandemic. And I think with that pre-existing stigma, that interaction is potentially significant. I think the more it's kept alive in the news, the more that will linger and potentially affect our attitudes. And so, what I would hope for is a changing of the discourse. And when I've been interviewed by journalists throughout the last year, I've really tried to highlight how complex body weight is and that it's not something that people can control in an effort to change that narrative. But I think it's really hard to combat these social discourses about weight and how tied that can be to diet culture. Now I've been seeing memes and stories, Will Smith and people being like, oh, I gained weight during quarantine. And now that the world is opening back up again, I got to, get back on track. And so I feel like the diet industry is really going to capitalize on that.
Thanks, Sarah. We have a comment, fascinating research. Thanks for sharing.
Thank you.
And I'll just give folks another minute or so just to consider whether they have any feedback, any comments, questions. I do think that hearing this, Sarah, I think you're going to be very busy. I think you're going to have a lot of work ahead of you with the research that you do, because it seems like there's just so much to explore in this area. I see we have one more question here. Kara has the question, do you think your participant source, that online app, influenced the results at all?
That's a great question. One of the problems with collecting data through online platforms such as Prolific Academic is trustworthiness of the data, and that people who are paid to complete these online surveys might rush through the survey really quickly and not be paying attention to what they're doing. And so that would be the one thing that I would consider with regard to influencing the results. And to get around that, we included a manipulation check. So right after participants were asked to read news articles, we asked them a question about, what were the content of those articles that you just read? And if participants got the question wrong, they didn't answer correctly, we just deleted their data because they weren't paying attention. And other than that, I think online surveys provide an atmosphere of anonymity that allows people to really be truthful. Whenever I've included scales on socially desirable responding, they do not come back significant. People don't tend to hold back when you're asking them about their attitudes towards higher weight people. It's not a taboo subject yet. Fingers crossed one day. And Courtney, did you have a question? I see I do here in the chat.
I just got excited to thank you for bringing forward the idea of unconscious bias. I think COVID-19 is a great, in many ways, kind of put a magnifying glass over what we already knew, and just it magnified it. And your work did that quite well in relation to the unconscious bias that we as a society have around weight and the assumptions around weight that are largely just that, assumptions. So I found it fascinating, and thank you for your work.
Well, thank you. I appreciate that.
Yeah, so a big thank you, Sarah, for that presentation. Lots of amazing insights, and I think there's a lot more to be done, as I said. And so let's move to the next presentation. So we have a presentation by Ryan Rhodes, and he's going to be talking about a study that he carried out with Sam Liu and Alex Lithopoulos in the School of Exercise Science, Physical and Health Education. And the study is titled COVID-19 and its impact on health behavior, predicting physical distancing and physical activity in a representative sample of adult Canadians. So just to tell you a bit about Ryan, he's a professor in the School of Exercise Science and Physical and Health Education, cross-appointed in the Department of Psychology, and director of the Behavioral Medicine Laboratory at UVic. His primary area of research is the psychology of physical activity, with an applied focus of physical activity promotion during critical life transitions, such as early family development. Dr. Rhodes is also one of the world experts on the intention behavior gap, made popular by New Year's resolutions that people struggle to enact every year. He's held over 100 grants for this research, and he has contributed over 425 publications, 30 book chapters, and 2 books. In 2019, he received the highly cited Researcher Award from Clarivate Analytics Web of Science, and he received the UVic Reach Award for Outstanding Academic of 2018. Dr. Rhodes is a fellow of the Canadian Academy of Health Sciences, Society of Behavioral Medicine, Academy of Behavioral Medicine, American Psychological Association, and a college member of the Royal Society of Canada. Dr. Rhodes is the editor-in-chief of Psychology and Health and associate editor of Exercise and Sport Sciences Reviews. So welcome, Ryan.
All right, thank you very much, Tanya. Okay, I'm going to try and share my screen here. We'll see how it goes. Okay. Good?
Yep, all good.
Okay, great. So let me just move over to the overview. So thanks everybody for listening. We actually have quite a bit to present today. So unfortunately, we're going to have to go for breadth rather than depth. But I am going to start with our study on physical activity and COVID-19. Alex Lithopoulos couldn't make it today. He's actually over at the Ottawa Heart Institute. He was a postdoc during this work. And then I'm going to pass the torch over to Sam Liu, who's going to finish with our work on stress and personality and some final takeaways. So overall, our goal was to understand, health behaviors during this pandemic, as well as explore how people were doing in terms of stress and personality. We had one survey, so this is sort of the central methods, and then we'll just sort of point out the results we had for each of the papers. But ultimately, we had a cross-sectional sample of adult participants, over 1,000 adults, and we engaged in a similar kind of third-party type surveying mechanism called Maru Blue. It tends to promise, I wouldn't call it a representative sample, but a sample representative of the census of Canadians. So it looks the same at the end, but whether it's actually representative is something for debate, which was brought up by Sarah in terms of prolific as well, kind of the same idea. And so this was an online questionnaire. It took about 20 minutes to complete for all our different measures. And our funding for this was the Faculty of Ed. And so we're very thankful for that. So this is just a very quick breakdown of what that sample looked like before we get into the different studies. So you can see here it's just slightly over 1,000 respondents, pretty equal distribution between males and females. We had a very small number of people who identified with transgender or a different gender. And then we had, you can see sort of middle-aged sample, about half of the group reported full-time employment. And this will be important in the physical activity component. About a third or so were dog owners. And so we'll talk about that in a moment. You can see a basic breakdown of most people were urban, but we definitely had some town and country. And then I'm going to talk about the physical activity component in a moment here. So let's chat about the first paper. And I do want to also acknowledge Chunqing Zhang, who was a visiting scholar at the time in both my lab and Sam's lab. And so, he was actually in the design of this, but unfortunately, due to the pandemic restrictions, he actually went back to Hong Kong, but we all finished it, of course, thanks to Zoom and got everything done together. And then the other co-investigator was Mauricio Garcia Barrera from the Department of Psychology. So I think this will come of a shock to no one that the benefits of physical activity are well established. Physical inactivity is associated with at least 25 chronic conditions. And honestly, if you could put physical activity into a pill, it would probably be the most prescribed medication worldwide. So it's very well established in terms of its breadth. It's also fairly well established in terms of its impact. So most of the big chronic diseases, if you were to engage in moderate to vigorous intensity physical activity, roughly 150 minutes a week, you could reduce your chances at about 30 to 40% of those major chronic conditions. So quite an impact as well. But unfortunately, we do have issues with participation. I don't think that will be a surprise, but what I'm showing here on this, this sort of bright graph is that it really depends how we measure it in terms of how we decide how well we're doing or not in terms of meeting those physical activity guidelines. So when we ask people in terms of self-report, it sits at around the 50th percentile or so. It can move around a little bit, but that gives you an idea. But if we actually put an accelerometer on people, it goes down quite a bit. So perception of physical activity, you can see is much higher than actually when we measure it. I do want to point out that physical activity takes many forms. So when we think of physical activity, a lot of people move right away to exercise, planned activities. And I think it's important to bring this up because when we start talking about the COVID-19 context, we can think about how it may have disrupted physical activity. We have other types of activities. We have incidental activities such as moving around in a supermarket, getting in and out of cars or moving through mass transit and buses and things like that. So these are not the purpose maybe of movement, but it's incidental to trying to get other activities done. And then of course we have spontaneous actions as well for movement. So this gentleman here is running away from a dog, and sometimes we break into movement that was unintended. So we have to think about that in terms of what may have happened with the COVID-19 context. And I also want to point out that the correlates of physical activity and what we know about why people are active and why they are not is very much socioecological in scope. So there's geopolitical reasons, regional transportation and national policy reasons, environmental reasons, as you can see here, social, interpersonal, and cultural norm aspects to physical activity, as well as psychological, individual level, and then of course all the way down to genetic factors. So it's a broad spectrum as to the reasons why. But what happened during COVID-19? Well, the first thing that most of us know is that the social and physical opportunity for recreational physical activity collapsed. So a survey in sort of mid-2020 showed that almost 100% of organizations had to engage in, they were affected by the restrictions, and many of them had to cease a lot of their programming. And so this also included the social activities, sports, physical activity classes, lessons, and even social distancing or physical distancing affected some people in what they were doing physical activity. So clearly there's something going on here. And we know that the earliest reports from China and the US, because when we conducted our study, it was, I believe in July, we already had some evidence that physical activity across the globe was drastically changed. Probably the biggest and most well-known report was actually from Fitbit, who published data to show how almost across the globe physical activity was down from their monitors. So what about Canada? Well, that's what we were looking at. We wanted to look at whether we could replicate the moderate and vigorous physical activity findings from China, Europe, and the United States in a Canadian sample. We also wanted to see if we could explore why that might be happening if we are having shifts, and use much more of a socio-ecological approach, kind of looking at all kinds of different correlates to get a picture of what's going on. So what we found right away is when people were reflecting at what their physical activity was before to 60 days after pandemic restrictions, there was about a 46-minute decline in physical activity. So that's looking comparable to the United States and quite comparable to some of the early reports out of China. But I think it got more interesting when we started looking at the profiles of people around physical activity guidelines. So you can see here that we were able to classify most people within these five profiles. And so on the left and right are people who largely were unaffected by the pandemic. So the inactive were people who were inactive before, and they were inactive when we sampled them. The ever active were the people who were active before, and they're active when we sampled. And then this interesting group was the group in the middle. And so the unsuccessful transition group, that's the group who were physically active at guidelines, and just something happened. And so they were inactive when we sampled. The adopters is this small group who became active after the pandemic restrictions. And then this breach and repair group is a particularly interesting group of people who were regularly active before, had some struggles within the first few weeks or so, and then found their way back to their activity patterns. So these are kind of the five stories. And these were the correlates of those five stories to give an idea of what might have been going on. And you can see here that the red is representing the multivariate ones. So these are the ones that stuck out when the equation, the multivariate equations were used. And so we used a discriminant function analysis to kind of try to understand these five groups. And ultimately, you can see that there were socio-demographic issues. So people who were younger were more likely to be active. People with higher educations, income, and employment status. There were COVID-19 related factors. So people who were engaging more in social distancing were engaging less in physical activity. People who felt that COVID-19 was more of a threat were engaging in less physical activity. You can kind of see the usual assortment of individual level factors. Those who enjoyed it more were doing more. Those who had more executive function and planning around physical activity were doing more. And those with habit and identities around physical activity were more likely to do it. We had a couple of interesting social factors. This is where I bring the dog one back in. So those who own dogs were walking more. We replicated this, by the way, in another study with families as well. So families with dogs were out and more active. And the interesting thing is that that group of adopters tend to be more parents with dependent children in the home. So maybe the story there is that they needed to do something with their kids. We were all locked in. So then maybe we'll go out for some play or to do something outside or to move around more as a group. And so maybe that was what was going on. We definitely had home factors. So within the home, so we had home equipment. Those who had home equipment were more likely to be active. And those who found home physical activity programming, whether it was YouTube videos or dusted off some old DVDs or whatever they did, they were more likely to be that breach and repair group. So maybe this is a group that went to the gym's closed. For a while, they didn't know what to do, but they sort of found their way back to physical activity. And then interestingly enough, the built environment outside of the home was not associated with changes during the pandemic. So just as a quick takeaway, we had some general declines in physical activity, but I think it's also important to note that over half of Canadians kept to their regular physical activity patterns. So it wasn't like everybody went down the same way. We had some evidence, and I'm in a publication you can see below I was a part of that actually was with using Prolific to assess the UK. And we found that incidental physical activity that I mentioned, that was down as well. So the little bit of exercise went down, but also people were traveling to work less. So there was less of that incidental. People were not maybe biking to work. They maybe were not doing the same routines for the supermarket and things like that. So all these little things were being affected by the pandemic that affected movement. Older adults was the most affected, but I'm glad to say that a lot of our messaging around physical activity was anticipating that and targeted that. So there's a lot of work at least trying to help older adults find physical activity. I thought that group of parents was interesting and perhaps worth looking at further particularly as the pandemic hopefully is starting to cease the restrictions, and we could see if that activity pattern is continuing. And then it's also important to note at the individual level that those types of things like identity and habit tend to be tied with physical activity maintenance. And we found that those were the ones that seemed to help people through the transition. So it speaks to those important factors, perhaps maybe over the typical educational campaign, which didn't have much effect. Just last takeaways before I move to the next one. The home physical activity options were definitely critical. And so this is important to consider opportunities in this new age. And we have some evidence that even those might be concerning. So we have a paper out right now looking at YouTube exercise videos. And we sort of, as you can see, people log in and then they have the same adherence drop off over time that you would see at gyms. And of course, gyms have made their entire banking future off of the fact that people don't come back. And so unfortunately, YouTube videos look about the same in their use. If you're interested in this area, I've also done some work with families and children. And so these are the publications that we actually did with families and kids. Okay, so I'm going to shift over to social distancing, or physical distancing, and our test of looking at that. So as we know, Canada put in restrictions for physical distancing almost right away because it is best practice public health guidelines to help with respiratory viruses such as SARS-CoV-2. But as we all know, adherence to those guidelines for some was a bit challenging. So we wanted to try to understand who was adhering to this and who wasn't. To do that, we used the extended parallel process model. This is a social cognition model that kind of comes from, for those who remember this maybe from Psych 100, the health belief model. It's sort of an extension of that, or protection motivation theory. It basically says that our perceived threat and our perceived severity of a disease or warding off some type of a disease is going to be partially moderated and potentially fully mediated, actually, I should say, by the sense of efficacy that we think that action is going to take. So in other words, if we feel for this, if physical distancing was going to make a difference and that we could physically distance, then we're more likely to do it. So that's the efficacy of it. If you find that the efficacy is low, then you just don't have a response. And we also, in this model, suggest that there's a fear control response. So this is the defensive reaction to whether you even trust the credibility of the government messaging. So we looked at that as well. Basically, what we found before is support for this model in basic research, but it hasn't been applied to physical distancing. And what we've also found in terms of moderators is that not everyone's the same. So females, older adults, and more educated people tend to follow the rules more. So we were interested to see if we could actually replicate that in Canada. So our outcomes were ultimately intentions to follow the government recommendations for physical distancing, actual assessment of physical distancing behavior, and then whether or not the fear control response was involved. We had our expected positive main effect for the efficacy on physical distancing. So those who thought that it was going to be important to do it and it was an effective way of not contracting the virus, we're more likely to physically distance. But we also saw these effects for age, gender as well. So older adults were more likely to follow the rules, and so were women. In terms of intentions, we saw the same type of effect that we were expecting that was in the behavior, but we also showed an interaction with perceived efficacy and threat. So those people who felt that there was more of a threat and had higher efficacy were reporting higher intentions. And then finally, with fear control responses, we also showed that there were negative main effects on that as expected. So those who had the lower score of trying to rationalize that maybe this isn't, that it's being overblown, were more likely to follow through. And we had a couple of interactions there, as you can see, so a slightly more complicated pattern. So overall, the pattern's suggesting that high perceived threat and efficacy will lead to the lowest scores of feeling that this is overblown. But people with low perceived efficacy were more likely to still do the right thing if they were female. So just in terms of our recommendations, governments should probably try to target or reach out to young males in particular, because they are the ones who don't seem to be following the rules as much. And I don't think that's a surprise to anyone if you've looked at, hopefully, the media reports on that. And that we should continue to focus on the perceptions of efficacy. Focusing on threat is fine, but efficacy is still very important. So I'm going to move over to Sam to finish.
Thanks, Ryan. Lots to dig into there. I'll just introduce the title of the presentation here for Sam, personality and perceived stress during the COVID-19 pandemic, testing the mediating role of perceived threat and efficacy. And so Dr. Sam Liu is an assistant professor at the School of Exercise Science, Physical and Health Education. His research focuses on using digital technology to promote health and well-being. During the past year, he's been focused on understanding ways to further personalize behavior health intervention. Over to you, Sam.
Great, thank you. Let me just, can you see my slides?
Yes, but we can see them in presenter view.
Oh, okay. There you go.
There it is. That's better.
All right, perfect. Okay, well, thank you for the introduction. And this is really a team effort to pull this project off. And I think it's pretty well known that the pandemic has caused a significant stress, not just in Canada, all around the world. As you can see from some of the survey that's been conducted and some of the recent survey coming out, 26% of the population in Canada reported moderate to high levels of distress. And this trend has really been seen all around the world. As you can see that there's about 20 to 30% increase in feeling of or increase in perceived stress. And we know that prolonged stress are significantly associated with mortality, as well as decreased overall health, as well as quality of life. So for us, it's particularly important to help understand why and how can we better manage stress during the pandemic. So this brings a little bit to talking about the stress appraisal. So the stress appraisal really talks about how individuals perceive stress during an event. So our stress level usually increases when we see or perceive this as a threat. And then if we don't have the ability to cope with this stressor coming in, then obviously we feel stress. So this is one of the main reasons that we feel that a certain situation might be particularly stressful. On the other hand, if we see a threat coming in as being particularly threatening, but we do have the ability or perceived efficacy to deal with this stressor, then our stress level may not necessarily change. But one of the factors that I was particularly interested in is how does this personality trait plays into this equation. So we know that certain personality traits are associated with an elevated stress. So we use the 5-factor model of personality traits, which consists of, as you can see, neuroticism, conscientiousness, extroversion, openness, and agreeableness. So individuals with high neuroticisms have the tendency to be emotionally unstable and experience feelings such as anxiety or worry. And conscientiousness, on the other hand, have the tendency to be responsible, organized, and hardworking. And individuals that are having higher level of extroversion have a higher tendency of being sociable, assertive, and positive. So the top 3 personality traits that we've seen is that depending on where you fall under, individuals with higher levels of neuroticisms have a higher tendencies of experiencing higher level of stress compared to individuals that are conscientiousness or extroversion. And one of the reasons that individuals with neuroticism or higher level neuroticism that are experiencing higher level stress is because they are perceiving, whenever they see a stressor, they're usually perceiving it as a higher, being a higher threat, as well as individuals with higher level of neuroticisms may not necessarily have the self-efficacy or resources required to deal with the stressor compared to the other personality types. So in our study, what we're particularly interested in is how does the personality factors play in during this pandemic. We wanted to see especially the personality traits of neuroticism, extroversion, and conscientiousness, how these personality traits perceive stress during a pandemic, as well as how they perceive change of stress relative to pre-pandemic levels. And then we also wanted to see, as you can see on the slide, kind of the mediators, so the mechanisms which cause these individuals to perceive stress differently. And this is particularly important because then understanding mediators or the mechanisms, this may be a potential way that we can actually build an intervention to help these individuals and promote well-being. So the two mediators that we're particularly focused on is perceived threat of contracting COVID-19, as well as looking at the self-efficacy or the skills required to prevent COVID-19. So first, I'll present the results of neuroticism. So individuals, what we found was individuals with higher levels of neuroticism was associated with higher levels of perceived stress during the pandemic, as well as increase in change of stress. So this is as expected based on previous literature. And what we found, the mechanism which is causing this to happen is that individuals perceive higher level of stress is due to that they are perceiving a higher level threat of contracting COVID-19, but they also are seeing that they have a lower self-efficacy or ability to prevent COVID-19. And what was interesting for extroversion was that we found that extroversion also was associated with a higher level perceived stress and as well as change in stress. Now, this was a little bit different from previous literature. Usually individuals with higher extroversion are more protective of stress. And this kind of goes into the whole media outlet saying that perhaps the pandemic was the golden age for introverts. So this kind of provided a little bit of evidence suggesting that this might be the case. And what we found was that these higher level individuals with higher level of extroversion, the reason that they are having these higher levels of stress was, one, they may not necessarily have the ability to socialize. And second is that we did find that the self-efficacy to prevent COVID-19 was slightly lower. And this kind of reinforced the idea that building self-efficacy among these individuals to prevent COVID-19 might be particularly important. And the last is the conscientious individuals. So individuals with a higher personality type of conscientiousness, we did not see an elevated level of perceived stress, as well as we didn't see a significant association change of stress. What we actually saw was that people with this type of personality actually showed a positive association with self-efficacy to prevent COVID-19. So here are some of the main takeaway from this particular study is that, one, personality traits should be taken into consideration when we're identifying individuals at risk in lockdown. And this is something that we may not necessarily consider, but it might be important if we're thinking about tailoring the intervention. And second is that this study informs how we can potentially develop future intervention to promote health and well-being. So one of the things that we identify is individuals with higher neuroticism, for example, may not necessarily be helpful for these individuals to focus more on the threatening aspect of contracting COVID-19, but may actually be more helpful to building up a self-efficacy. And same with extroverts, that we need to be particularly mindful of looking at how can we build up efficacy and self-regulation skills during these particular time. So overall, this study, one of the strengths that we had is that we had a very large sample size, and then we were able to conduct study fairly quickly to inform an early phase of the lockdown. But there are several limitations associated with this entire project. So the first is the cross-sectional design of the study. So the cross-sectional design plays a limiting factor for us to assess the retrospective aspect, because some of this questions we did ask them to recall what the stress level or recall what their physical activity level was pre-pandemic. So this could create some bias there. And second is that we only included English reading participants. And then we do have an underrepresentation in participants from Quebec. So the overall takeaway message for the entire project is that first, the COVID-19 caused significant change in health and lifestyle behaviors among Canadians, both from physical activity, lifestyle behaviors, as well as people's mental well-being. We have identified potential factors such as demographic factors, psychological, social, and environmental factors that can be critical to promote health and well-being during the recovery phase, but also perhaps prevent any future waves of COVID-19. And the last is that the findings from this research project can be extremely helpful in informing the development of future health promotion interventions. Thank you very much.
Oh, thank you, Sam. Really interesting findings, and I think we've just heard quite a bit between Ryan and Sam and the 3 studies that they presented. So I'm sure there's going to be some questions and comments. So I'd like to invite folks to indicate in the chat if you do have a question or comment. You can just type that one word, and then you can unmute yourself and ask or speak. Or if you'd like to just type into the chat. And I think while people are reflecting on what feedback they might have, I would ask both Ryan and Sam maybe to talk a little bit about the recovery phase that we're entering now and how the findings of these studies might apply as we enter this kind of back to regular life phase that we're getting into. What are your thoughts?
You want to go first, Ryan?
You want me to go first? Sure. Yeah. No, it's that's a great question. So on the physical activity end of it, I think that it's an opportunity to reflect a little bit in what we've been doing in terms of our health behaviors, our physical activity behaviors. Recognize that some of us may have formed some habits that were sort of survival habits or habits of necessity that we may want to break to get back to some of our positive habits. Some of us, as you can see from the data that we presented, have actually engaged in different types of behaviors, and maybe they've found new ways to be physically active. And so we'll want to continue to integrate that into their new life moving forward on that. But it is a time to reflect and think about, well, what changes do we want to make as we're starting to open up again, and how might we want to follow through with that? In terms of the social distancing or the physical distancing component, I mean, I think there's some interesting points around if we do move into a new wave or we're heading into where we still have to do that, it looks like, for a while. There's certainly some findings that we had that we think that messaging should include, in particular, reaching the certain groups of people who are still perhaps not doing it as much, but also looking at that efficacy component, which is so important. You know, the idea that was broken into this idea of the response, so that this makes a difference, and also how people can do it is very important. So I think that those would be the take homes from the 2 studies I presented. Sam?
Yeah, so I think the personality and stress study is more for preventing future waves, so taking personality into consideration. And I think from an intervention perspective, even for physical activity or any other type of behavior, incorporating personality can be an interesting way of tailoring. And there's some literatures around there as well.
Well, thank you both for those responses. And I think that, yeah, there's going to be a lot to consider in the upcoming phase. And I certainly enjoyed just how accessible you made your findings from both of these studies, because I know it can be quite technical, but I found it very, very easy to understand. And there's a comment here from Catherine: the importance of media framing seems key in all studies presented today. So that definitely does seem to be a thread running through Sarah, Ryan, and Sam's research, is just the discourse, around these issues. So I see that we're almost at time, and I want to be respectful of everyone's time. So I just would like to wrap up by saying a big thank you to the presenters. Thank you, Sarah. Thank you, Ryan. And thank you, Sam. Those were fascinating insights that you shared with us. I also want to thank all of the participants for joining us today. And finally, I'd like to say a special thanks to the other members of the organizing committee, Dr. Catherine McGregor, who initially had the inspiration to host this symposium. She's led this initiative to share the knowledge generated by Faculty of Education research teams with a wide audience through this format. I'd like to thank Courtney Baldwin and Hector Vasquez for providing technical support throughout the sessions, and Courtney as well for setting up and managing the registration page on Eventbrite. Lauren Frost provided support with communications and getting the message out on social media, and Elaine LaBerge was responsible for the conceptual development and graphic design of the poster you see behind me and the great promotional materials. So thank you everyone for attending today's session. We hope that the symposium and whichever of the 4 sessions you attended have provided you with some new insights and have left you with ideas for further exploration. So that's a wrap. Wishing you a great rest of your day. Take care.